long, quite a saddening story. Now, let's continue, move forward. And the vaccine manufacturing sector across Kenya and Africa are accelerating efforts to bridge financing, skills, and regulatory gaps in a bid to boost local vaccine production following a sharp decline in donor funding. Now, with Africa currently importing more than 99% of its vaccines and the bulk of its essential medicines, experts warn that the continent remains highly vulnerable to global supply disruptions, price volatility, and geopolitical pressures. The concern dominated discussions at the ongoing East Africa Regional Global Health Security Summit held in Ruiru, Kiambu County, which has brought together more than 1,000 stakeholders from governments, research institutions, and the private sector. Now, speaking at the summit, Dr. Mayanga Lucy Mazarba, Regional Director of the Africa CDC Eastern Africa Regional Coordination Center, said Africa's over-reliance on donor support has exposed major weaknesses in national health systems.
As you produce those products is enough to supply the country, but also we have capacity to export. So what is important is that for even one antigen that we produce, it will only be viable if we produce to be consumed locally and also exported. So it's not just the Kenyan market, but also for Biovax to be viable, we have to export to the African markets. We
noticed that the ODA has actually dropped by over 70%. And then when you have a country that is totally, like 8% of its health budget is dependent on ODA.
Pharmaceutical space where we are able to produce ourselves and export, not import, reduces the cost, and there is a proposition for the private sector funding for it to come forward. Today we dealt with the topic of collaboration, because the biggest problem that we have in this space of Africa health security is the collaboration between governments, between industry and academia.
Now let's revisit the story I was alluding to